Hi, I'm Bram Wagner from the Access to Medicine Foundation. If you invest in healthcare companies, you may already realize the important role that these companies have in expanding access, and they do so through their vast resources, their global presence, and their capacity to innovate. But meaningful change doesn't happen automatically. It requires clear expectations, strong data, and coordinated action across stakeholders. In this video, I'll focus on the role of the Access to Medicine Foundation in the wider ecosystem, including how we work with investors. So let's start with our change-making model. Our change-making model is solution-oriented and collaborative because we want these companies to succeed as important global health partners. But we also recognize that they can't do it alone. That's why our change-making model focuses on all key actors, not just the companies, but also their investors, governments who create the enabling conditions for these companies to operate, and also global health organizations who drive coordinated action. The model is built on three core pillars: building consensus, measuring, and engagement. Our work starts with bringing different stakeholders together and having open conversations about what hinders access and what the possible solutions could be. We then translate these conversations into metrics, which we publish in our methodology reports. And this is valuable for companies because it shows the companies what society expects from them, where they should prioritize their efforts, and how they will be assessed. Our convening platforms, like the Health Equity event for investors, are central to aligning the expectations across stakeholders and provide companies and investors with meaningful insights. Once the expectations are clear, we turn to measuring performance. We collect data from the companies themselves and the public domain, and we assess the performance against the metrics that we made. And this allows us to identify opportunities, identify best practices, and to track their progress over time. And by benchmarking the companies against their peers and the industry averages, we create a race to do well. We also highlight what works because change accelerates when companies have the ability to learn from each other. And we do this in our reports, at our own convenings, but also at external events. The third pillar of the change-making model is engagement. Again, not just with the companies, but also with investors and other stakeholders. But we do directly discuss our findings with companies, supporting their internal access teams in the process of change-making. And we help their senior leadership to then translate the insights that we deliver into long-term scalable solutions. For investors, we provide the research and data that they need to have effective engagement meetings. And they can use their insight to then challenge leadership with targeted questions such as, what kind of strategies does your company have to improve access to medicine in low and middle income countries? How are your executives also incentivized to deliver on those commitments? And how do you measure and report the number of patients that you actually reach with these strategies? Having the backing of investors is essential. Without their backing, corporate behavior won't change, so it's important that they are on board. When investors signal to a company that access is a strategic consideration and not just a philanthropic add-on, the companies listen. In the past, we heard too often from companies that they couldn't change their approaches because the investors won't let them. But now we hear more often from companies that they changed their approach because investors raised an issue. But integrating the topic of access to medicine into an investment process can be complex. That's why we support this by housing all of the expertise under one roof and building investor capacity, for example, through our targeted investor briefings. And we also host collaborative platforms where investors can come together and learn from each other. So our engagements with different stakeholders, with the companies, investors, governments, and global health organizations all ultimately help us to transform the significant challenges into solutions. So let's turn to how we work with investors concretely. Investors are strongest when they pool their influence, and that's why we have two collaborative engagement initiatives that enable this. Starting with our SDG-free collaborative engagement, this is investor-led and it uses the Access to Medicine Index to drive companies to increase access to medicines in low- and middle-income countries. We are also founding partners of the Investor Action on AMR initiative, which leverages the influence of investors to address the global threat of drug-resistant infections. We provide support to all of our signatories, for example, by helping them to prepare engagement meetings, by helping them to shape their voting and investment policies, and responding to their general access-related queries. And we do all of this for free. There is no membership fee associated with this. So to sum it all up, our change-making model starts with building consensus on what the problems are and what the solutions might be. We then benchmark company performance and we engage with all stakeholders in the field. Investors specifically can contribute directly through our collaborative engagement initiatives. If you're an investor and you would like to use our insights in your investment process, or you would like to build stronger engagement strategies, then please reach out to our team. All of our research and tools, like the company report cards, are freely available on our website, and we are here to help you. Thank you very much for watching.